have used. On the bottom there is use of any conventional tobacco products. And again, it's an 80-20 split. 20% have used these products. And then when we look at the e-cigarette use rates, this is actually, in 2016, was right on par with the state average of 1 in 5 Cook County teens having used electronic cigarettes. I want to point out, though, that 2016 is prior to any of the newer products, such as the Sorin or Juul, which I'll talk more about. This is prior to any of these coming on the market, especially locally here in Grand Marais, in Cook County. These products didn't come on the market until about a year or two ago. And so in this next round of 2019 data, when that comes out, we are expecting to see a very significant increase in these numbers. So we're very anxiously awaiting on those to be released. So e-cigarettes have kind of progressed a lot over the last several years. So I just want to kind of give you an idea of when I'm talking about e-cigarettes, what are they? What are the kids using? This screen here shows a variety of different e-cigarette products. And e-cigarette really is any electronic form of nicotine delivery device. So all of these devices have a lithium battery within them that when the user takes a puff off of it, it turns on that battery, heats up a coil, the liquid with the nicotine and flavors and chemicals is vaporized, and the user inhales that to get their nicotine hit. So the bottom left, there's e-hookah. In the middle, we've got an e-cigar and a pen form. Then there's the mod boxes are the if you count 1, 2, 3 in to the right, that's the mod box. Those are modifiable, that's why they're called mod boxes. And those are the more expensive products that you buy at a vape store or a tobacco store. And the users generally are buying those to try and make big vapor clouds and do cloud chasing competitions or try and get as much of a deep throat nicotine hit as possible. On the top right, that's a Cig-a-like, which is one of the really first generation e-cigarette products. Super cheap, disposable, you get about 200 puffs, you throw it away. And very low nicotine content in those products. And then the bottom right is a variety of all of those. One of the things that we hear commonly about electronic cigarettes is that they are harmless water vapor, that they're safer, it's a healthier alternative, and none of those are true. There's actually no water in these products. The liquid is primarily made of propylene glycol and vegetable glycerin, flavoring, and nicotine, and therefore, if there's no water in them, they cannot just be water vapor. And when I'm talking with youth and community members, I just point out that healthier does not equal healthy, and safer does not equal safe. When we're comparing cigarettes as our standard, there's a lot of things that are healthier and safer than that, but that does not make it safe or healthy. And so this is just a short list of some of the chemicals that have been found to be in the e-cigarette products, not the least of which is nicotine, which I'll talk more about how that affects the teenage brain. So how many of you have heard about Juul? Raise your hand. Okay. Pretty much everybody. Okay. So Juul came on the market about 2015 in the U.S., and in the last few years it came on the market locally here in the last about 2 years or so. And so Juul is this small device. It looks a lot like a flash drive. It very conveniently just clips into this charging piece that plugs right into the user's laptop to charge it. This product really took off with youth in the area pretty severely the last couple years. They come with a little pod that just clicks in, and kids can very easily just hold this securely in their hand and take a puff. And I've actually directly seen that in the classrooms as I've been presenting to youth. I've seen kids hiding their use of these products. They'll hide it kind of under if they've got a sweater on or a jacket, they'll hide it under there. And so this is one of the primary products that kids are using currently. One of the things about Juul and these newer products that have come on the market is is the nicotine content is significantly higher than original e-cigarettes, and then what kids were originally getting. And so on the bottom of this chart here, you can see the darker blue line. That is your average e-cigarette. So the Cigalike or the original first generation e-cigarettes, they just didn't have the nicotine content that would hit the user's brain and really get that high from that nicotine. On the top, there's the yellow part. That's a cigarette. When a user takes a puff off of a cigarette, that nicotine spikes right up and hits the brain really quick, and they get that pleasure reward cycle going. So what Juul did is they found a way to create liquid nicotine called nicotine salts. And it's just a different chemical way of deriving the nicotine and putting it into a liquid. And you can see is that lighter blue in the middle, and it really mimics the hit of nicotine that a cigarette does. Now, when kids first started using these, they didn't realize, they didn't know because they weren't labeled well, they didn't know that there was nicotine in them. So kids are getting addicted in about a week or two. And the package on Juul says that each pod contains about as much nicotine as 1 pack of cigarettes. We've actually found studies now that are showing that it's actually closer to 2 packs of cigarettes. And when kids are getting addicted, they are using, on average, at least a pod a day. So one of these pods, 2 packs worth of cigarettes of nicotine in one day. And some kids are telling us that when they are so addicted, they are using upwards of 4 pods a day. So we have an entire generation of kids who would have never been pack-a-day smokers, who are now at least a pack or 2, if not upwards of 8 packs of cigarettes worth of nicotine every single day to fuel their addiction. So some of the other products, and I kind of scattered products among all of you up there, and you can kind of pass those around if you want to look at the different ones. Most of those are products that have been confiscated from students at schools in the area, and that the SRO, the resource officers, have provided us with to use as demonstrations. This product is called a Sorin. You guys do have that one up there. Again, very small, very sleek. This has really, really taken off in the last year among youth in the Northland. And what makes it different and what makes kids really enjoy it is that they can refill this with any nicotine salt juice that they want to, any flavor. Whereas Juul, you're really kind of stuck with exactly the pods that they create, and you don't get the variety. And so kids really like this because they get more variety with that. On the left-hand side is the Sorin Drop, and on the right is the Sorin Air, and those are just 2 of the different forms of products that kids are using. One of the other ones that we are seeing and hearing about is called Vaporware. So this is a product that kids are able to purchase online. And they are putting their vapor pods into one end of the hoodie string, and on the other end is the mouthpiece, and they can vape through their hoodie strings while sitting in the classroom. And so this is one of the other things that we are seeing out in our communities now at this point too. So one of the things that we talk about when addressing this in communities is the perception of harm. This is a study that shows the perception of harm and use rates of cigarettes and marijuana, so not e-cigarettes, but it's easily compared. And so you can see how as the perception of harm of cigarettes increased over the years, use rates declined. With marijuana, as we were seeing with e-cigarettes, when perception of harm is high, use rates are low, but then as the perception of harm goes down, use rates go up. And so currently in our communities, there's a very low perception of harm around e-cigarettes. And so we're working to make sure that people understand and are aware of the harms and the consequences of these products, so that helps decrease the use rates. One of the other ways that can happen is through policy making, which I'll talk in a minute about how certain policies can help to increase the perception of harm of these products. So I mentioned nicotine quite a bit so far. And for teenagers, regardless of any of the other potential risk or harm of any of the other chemicals that are in these products, the bottom line is that nicotine is never, ever safe for the teenage developing brain. And we have kids who are getting unprecedented levels of nicotine into their systems. And this is just a short list of some of the potential harms that can come from that. We're hearing over and over from teachers of the difficulty of concentration in the classroom. Kids are constantly getting up to ask for bathroom breaks or to go to their locker to get hits of their products, or they're doing it directly in the classroom. One of the other big concerns is future addiction. The younger that you are when you form an addiction pathway in the brain, the higher risk you are at later on down the road for other addictions. So right now we have big concern around opioid addiction in our communities, and rightfully so. And we're really worried and concerned to see what's going to happen with all of these kids who are forming these strong addiction pathways with this nicotine at such a young age, and what that might lead to. And we also know that the majority of opioid users are also tobacco users and started with nicotine, started with their tobacco addiction before they went to opioids. So one of the concerns to keep in mind around these products. So talking about policy then, what can communities do around policy to help decrease the use rates and help increase the perception of harm around these products? Tobacco 21 is one of the primary policy options that is being looked at in communities right now. It was first studied in 2015 in an Institute of Medicine report, and this is just a brief overview of some of the incredible public health outcomes that the study found that Tobacco 21 policies could have if implemented across the country. So you can see reduced smoking rates by 12% and smoking-related deaths by 10%. One of the questions I like to talk about right away, because I generally get this question everywhere I go, is, well, if you're 18, you can sign up to fight and die for your country. Don't you have a right to choose what you put into your body and what you purchase? And in fact, every single branch of the U.S. military supports Tobacco 21 policies. They have stated a goal of a tobacco-free military because they want soldiers who are fit, healthy, and ready to fight, and not addicted to any substance. So I just like to point that out because I know that question always comes up. So across the country, Tobacco 21 is taking off in statewide policies. Minnesota did make quite a bit of progress this year at the state legislature. It made it all the way through the House. We did not make it through the Senate this year on Tobacco 21. And so that's why it's just all the more important that local cities continue and local counties continue to work towards these policies to show the state that this is a priority and that this matters. And so this is a list of some of the states that have passed it so far. And at this point, 36 Minnesota communities have passed Tobacco 21 policies. So that's up from just 5 last summer about this time. So just this past year has really taken off. In the Northland, Hermantown was the first northern Minnesota city to pass Tobacco 21 this past fall. Duluth passed in January. We're currently working in Two Harbors as well with the city council to address this, and are here in Cook County as well. Beltrami County and Bemidji have passed as well in the Northland and scattered them throughout the state. Tobacco 21, if implemented, has shown to have, on average, 25% decrease in teen tobacco use in just the first year of implementation. So significant percentage of decline in teenage tobacco use. And one of the things to keep in mind is with Tobacco 21, the whole premise is that when there are 18-year-olds in high school who can legally purchase tobacco products, they are doing so and then they are selling it and getting it to the younger students. The 18-year-olds are the primary pipeline of these products to the underage students. When you raise that age to 21, it really helps to take it out of the high school setting so kids can't get access to it as easily. And so it's just really trying to cut off that access as much as possible. And so there is my contact information, and I am happy to answer any of your questions.
Anybody have questions?
Ginny?
Yes, Amanda, so when you say that there's a certain percentage of tobacco users, what kind of data do you refer to on that?
So you're talking about the Minnesota data or the teen data? So Minnesota does a Minnesota Adult Tobacco Survey every 4 years. So that's where that data is coming from. And then the youth data comes from the Minnesota Student Survey data, which is every 3 years.
Okay, so that's a survey that they fill out themselves rather than going to a gas station to find out how many cigarettes they sold or
Oh,
how
sure.
many Juuls they sold.
Yep, so it's a self-done survey within the school setting, and then the adult one is done by phone and by mail. And then some of the data too as well, in the Northland, we have the Bridge to Health survey, which is done every 5 years, and that has been a trend data for 20-plus years now, so.
I noticed in some of my travels, when I stop to get gas, I look to see where they have their Juul.
Yeah.
Some of them have moved it to the back shelf, others have not yet.
Yep,
So that would be helpful, at least if they would do that.
yeah,
They're
absolutely.
very attractive.
Oh, yeah, absolutely. I mean, they're a very nice-looking product. Gary?
Amanda, I'm wondering about the process from becoming aware as we are now to actually enacting something like this in our community. What's a typical process look like, or what are the steps that communities go through to get from A to Z?
Right. Yeah, I mean, it can look a little different for every community, but the basic process would be starting with where we are now, having the conversation and awareness. We have been doing some education within the community, so getting citizens aware through public health or through schools, and we certainly plan on doing more public education as well. But beyond that, the American Lung Association is happy to offer assistance in the process, and that's really what my role is to make sure that this is as simple and easy as possible of a process. We have access to the Public Health Law Center, and so we've already been in contact with them and have a draft sample policy language for Tobacco 21 based on the current county policy. And so it would be a matter of the county looking over the draft policy language to see if that is something that you would want to adopt. Certainly, there's room for edits if needed, and we would provide any guidance on that, what is the best practice for language around a tobacco policy. And then from there, it would be whatever your process is for a public hearing or introduction and a vote. Yeah.
Any other questions? Dave?
What, you mentioned the argument about the military and the age to serve. What are some of the other pushbacks that you've heard, and how have communities dealt with those?
Great question. So some of the main pushback we get is actually really just from the vaping community, both in Hermantown and Duluth and in a lot of the other rural communities that this has been pursued in. We've had actually zero pushback from any of the just convenience store retail community and owners. We didn't see a single one of them come out in opposition against this. And in fact, a lot of the retailers say that they're at best, or at minimum neutral, and at best supportive of this, because they don't want younger, people getting addicted to this product. And so the primary pushback has really just been the what we call the vaping community, those community members who are vaping and feel very strongly that this is a product that has been really helpful and useful for them. And so that has really been the main pushback that we have gotten. Or if there's a vape store specifically in a community, which I don't believe there is a vape store here. And so I would imagine minimal pushback really on that front. Yeah.
What's the penalty for a teenager who's caught with an e-cigarette?
So that's kind of one of the best practice guidelines that we actually like to talk about a lot is the penalties for youth, because we really, the American Lung Association and the broader tobacco control community do not want youth to be penalized for an addiction that they have. We see youth as the victims of an industry that has been targeting and marketing them for years. And so for a youth who is caught, we encourage communities to remove what we call PUP penalties, possession, underage, and purchase. And so we don't want youth to be penalized monetarily. There are guidelines from the Public Health Law Center on how to address the use among youth in non-monetary penalties. So whether that's through the school and doing certain in-school service projects, or they have to write essays, things like that. The focus really, when it comes to penalties, is actually more on the seller. We want to penalize sellers for selling to underage youth and not the underage youth.
Youth don't have a large earning capacity, and so when you take their vape away, you've already hit them in the pocket, and I respectfully disagree with you. I think you should hit them in the pocket harder. And so, I mean, for my child, money is important, and so instead of just taking away things, and community service is another. I know we do a lot of social justice programs, and those are also helpful. And then maybe penalizing the parents, even though we often don't have a lot of control, and they don't often do it in front of us, and we don't find out until someone else tells us. So it's a tough thing. I don't know if 21 and older will work because they can buy them online. They can lie about their age. They can use fake ID online. They're very resourceful and intelligent little beings.
Yeah.
Carla?
Are there any model-type programs to help adults or youth withdraw from vaping?
So there are some that are in process of being worked on. For adults, there's the quit plan, and that's kind of the standard model. For youth, there has not been a standard other than counseling, which at this point, because youth are so addicted, just doing counseling is not going to get them to successfully withdraw, because it is a withdrawal process from nicotine. And so there are different programs and different models that are being kind of piloted right now, both in the state and across the country. And so that's definitely something that will have to be addressed as we move forward.
Any other questions? Thank you so much for your presentation. Thanks for your time.
Thank you for what you do.
All right, Director's Report.
Okay. Thank you again, Amanda, for being here this morning, for sharing this information and your expertise.
Yeah.
I just want to reiterate as well that Grace and Amanda and I are working together to get some additional education information out to the public, in addition to our article that was in the Cook County News Herald last week. We'll be scheduling some panel-type discussions and bringing together partners in other key areas of the community, including the schools and primary care health, to just continue the conversation about teen and youth tobacco use in Cook County. Anything that you would like to add to that, Grace? So Grace will be sharing more information as those dates are set. Jerry?
Just a comment, and I'm guessing you heard this last month, but the advisory committee had Amanda's presentation, and there was certainly a strong feeling on the committee that this is the direction we should be moving, and wanted to recommend today's presentation as a next step, and really doing what we can to arrive at that point of support for something like T21.
Yes,
Thank you.
Jerry. Okay, well, I have a few brief updates this morning and some additional context for some of the items for board action before you this morning. For staff updates, we are recommending the hire of Matthew Baxley as our community support worker. Matthew is he brings some extensive education and experience in mental health, including a master's in marriage and family therapy, and experience providing work to adults with mental illness one-on-one and some group facilitation. So we're very pleased to bring his name forward to recommend him for hire. This morning, Matthew is slated to start orientation and training on June 26th, and then will be beginning full-time in the office on July 8th. And again, just a reminder of the history and the steps that we took to come to that decision is that historically we contracted with HDC to provide this community support service. Once HDC closed their Grand Marais office, this left a significant gap in services to adults with mental illness. Initially, we had looked at providing this service through a purchase of service agreement, a contract, contracting individually with someone to perform this service. After consulting with the county attorney and doing some additional discussion internally, determined that it would be in the best interest of both the department and the people we serve to have this position be housed internally within the department. It is funded with grant funds from the Department of Human Services, so we get adult mental health dollars every 2 years. Those will be used to fund this position. We also have an offer out for an adult services social worker. We intend to bring that for approval before the regular Board of Commissioners next Tuesday, as we're still in the process of notifying applicants. But just wanted to share with the board that we had some really excellent applicants for both of these vacancies, and we're just really pleased to see that people are interested in working with the county. A few agency updates. Under items for board action, we have approval of membership to the new local advisory council for mental health. We are continuing to accept applications. We had, I believe, 8 individuals apply. I met with Jerry and Carla. We reviewed each of the applications and are recommending that all of those who applied to date be appointed to the committee. We are also recommending that both Jerry and Carla, as our advisory chairs, be approved to serve on that committee as well. And as I mentioned earlier, when requesting the adjustment to the agenda, I intend to talk to the Public Health and Human Services Advisory Council membership. A number of those members were involved in planning for the new committee and had expressed interest. Jerry and Carla and I discussed that we would be comfortable just recommending that those individuals who have already applied and been approved to serve on the Public Health and Human Services Advisory Committee could also be appointed with board action to serve on this local advisory committee. But we still are seeking interested applicants, community members, to serve on the local advisory committee for mental health. Our bylaws stipulate a membership no greater than 25, so we're just under halfway towards that goal for membership. Really looking for more people, although we're close with the makeup on the committee as it stands, with the mix of persons with lived mental health experience and professionals and interested community members. We're really looking for more people in the community who have experienced the mental health system, either directly or through a family member, especially a parent of a child with mental illness, to contact the agency for more information on applying for this committee. And they can call either myself or the front desk, and our application material is available on our website as well. One of the other big projects that we're working on as a department and statewide is re-procurement for managed care. So these are the managed care companies, insurance companies that provide services to our public health enrollees, both children and families through our PMAPs, the Prepaid Medical Assistance Programs, and Minnesota Care, and then some of the managed care services to seniors as well. So we are in the process of reviewing all of the RFPs from the managed care companies to provide services in Cook County. Late last year, actually, we met as a region to discuss priorities, what types of information we would want to see come through on these RFPs. So I met with both our internal management team as well as Health and Human Services directors throughout the region to talk about what types of of areas of interest or what types of things we want these companies to address in their RFPs. So we're still in the process of reviewing those and are required to bring forward a board resolution for the families and children's health plans, and we'll bring that to the next regular Board of Commissioners meeting. And this is for 2020. For the 2020 will be the next change potentially in health plans for Cook County residents. We are also preparing for the next round of grant making for the Public Health Fund, formerly the discretionary or non-mandated funds. We met with a subcommittee of the Public Health and Human Services Advisory Committee last month to talk through the process and discuss improvements, what we might change in the application form, the timeline, and the process for 2020 funds. Grace has drafted a press release and a few updates to the application based on feedback from the committee members. She sent that out yesterday at the end of the day. We intend on sending out a press release with more information on that process for 2020 before the end of the month. And similar to last year for 2019 funds, that open period for applying for grants will be from July 1st to July 31st. And new this year, Grace has set up an open house that we'll be publishing along with the media release and application materials for people who are interested in learning more about the grant making process and how to apply. Can come to this open house here in the Commissioner's Room to learn more. And that's July 12th, right, Grace? Okay. Last update I have for you this morning is regarding a tabletop exercise that we completed within the Public Health and Human Services Department. This is required for our public health emergency preparedness to be completed annually. So Grace led us in a tabletop exercise, and the scenario was that there was an intentional aerosolized anthrax spray on the July 4th weekend. So we talked through and we were... Yeah, this was all defined by MDH in terms of the exercise that we were going through statewide. Everyone is looking at PODS, which stands for Points of Dispensing. And it's a way for us, and we were very fortunate to have outgoing emergency manager Valerie Marasco join us in that exercise as well to talk about the interface between public health and emergency management in this type of response. So the public health response in this situation would be to actually administer the medications, to work with the national dispensing, help me out here, Grace. The National Strategic Stockpile is who we would work through to get the medications delivered here to Cook County in the event that we had to have medical countermeasures available to citizens. So it was a great learning experience for all of us. Grateful to have all of the supervisors and management team involved in this process so we all learn more about what our responsibilities are in an emergency.
Any questions? Robbie?
Yeah, what was the total amount of grants we gave out last year for the non-mandated?
Last year, our total amount was $130,017. We had about $186,000 in requests. So a few of the applicants did not receive funding, and a few of the applicants received less than they had requested. And that's all available, I believe, on our county website, the amount that was granted last year.
Any other questions? How long does it take to get those emergency response inoculators or whatever they are, since we're so remote?
Hours.
That's awesome.
Mm-hmm.
Cool.
So they come from the airport via UPS within 12 hours. So we work with MDH, and then once we request the medication from the strategic stockpile, which is through the CDC.
Cool.
And Grace is
nervous to
actually...
ask that question.
Grace will be participating in an actual exercise, not a tabletop exercise, with Lake County next summer, related to points of dispensing. And that'll be opened up to people from Cook County who want to exercise that as well, members of the Emergency Service Committee, as well as our department.
Cool.
We'll actually be sending a pallet of fake medication. I don't know what they'll put in the bottles, but they'll send us a pallet of bottles to take to county and we'll distribute them so they were antibiotics, anthrax.
Awesome.
So I have a question, like what kind of medication would be necessary in an emergency?
It depends on the nature of the emergency. So right now, the focus is on antibiotics because the state is focused on anthrax. I believe the next rotation of infectious disease response is pandemic influenza, in which case it would be a vaccine.
Oh. Mhm.
So it depends
Oh, okay.
on what the nature of the
Mhm.
disease outbreak is.
Yeah, my FEMA training was on SARS, which there isn't really
Yeah.
that's mostly a quarantine response to that,
Hmm.
which was very interesting and very intense. It was 8 hours of figuring out how to manage that when someone gets on a plane. Thank you for all of that work. I don't know where Jerry is, but we'll move on. There he is. We will move on to board action. Item A is to approve hire full-time community support provider Matthew Baxley. Does anyone have any questions? Allison covered it briefly in her update. Can I get a motion?
So move.
Second?
We have a first and a second. Any discussion? All in favor?
Aye.
Aye.
Any opposed? Motion passes unanimous. Item B is the recommendations for appointment to the Cook County Local Advisory Council, which will be combined with item E from the consent agenda with adding Roger Linehan. And then what do you want for commissioner presentation? Are you approving that today also?
We could address that now, or we could address that at the next meeting. That we'll be continuing to accept applications and appointments. And again, I'll be reaching out to the PHHS Advisory Committee. So I'll let you determine if you want to make a recommendation for commissioner appointment today or in the next round of applications.
Are you doing commissioner and alternate, or two commissioners and alternate?
I think we'd follow the PHHS Advisory Committee, which is a commissioner and alternate.
Okay. What's the will of the board? Do you want to tackle that today or wait until the next meeting? So all enthusiastic.
Maybe wait and we find out a little bit more what's involved.
Okay,
Would it meet,
go ahead.
thank you, Madam Chair. Would this meet monthly?
Yes. And we will wait to set a meeting schedule until we bring the group of appointed committee members together to determine what's going to work best for the group in terms of time of day and day of the week.
Dave?
Do you have any thoughts on having a different commissioner from the representative on the Public Health and Human Services Advisory Committee, or same commissioner? From the discussions with the advisory committee, it sounded like we wanted to really keep things separate and equal there. So, whereas it seems to make sense if it was the same commissioner, it makes maybe more sense to have a different commissioner there.
I think we're interested in who among the commissioners have a particular interest in being on that council. That would-
I'd certainly have interest. I'd never have lack of interest. But for the sake of trying to keep things separate, I think that makes more sense. So, so I'm passing the ball here.
Yeah, you know.
But maybe we're kicking the can a little bit too. It sounds like we'll
Yeah.
think more about it and,
You know who will pick your ball up.
A commissioner? Okay.
Pass me your ball anytime. All right, so can I get a motion to approve the citizen representatives with adding Roger Linehan?
I will move to approve that list of citizen representatives to the local advisory council.
Support.
Any further discussion? All in favor?
Aye.
Aye.
Anyone opposed? Motion passes unanimous. Minnesota Government Access Resolution Designation Signatory Authority for Cook County. That's this piece of paper, if anyone wants to see it. Can I get a motion to approve that?
So moved.
Support.
Any discussion? All in favor?
Aye.
Any opposed? Motion passes unanimous. And then, is it D we removed?
Yes, it's D that we removed as evaluation team members haven't completed their evaluation. We'll bring a recommendation before the regular Board of Commissioners.
Okay, we will move on to committee reports. Arrowhead Economic Opportunity Agency, Mr. Mills.
I don't think I have anything to report.
Okay. Arrowhead Health Alliance Joint Powers, Mr. Mills.
Again, nothing to report at this meeting.
Arrowhead Regional Corrections, Mr. DeShaw.
We meet Friday.
Okay. Arrowhead Regional Development Council, Ginny.
Nothing to report as of right now.
Community Health Board.
We did meet, and the personnel committee for that met, and they have a very robust and good personnel policy, and I learned a lot there. And then we also talked about some of the large changes in our region to healthcare, and with the expansion of service providers in Duluth, the idea was brought forward to try to give some more input as far as what the community's needs are versus how the service providers are growing. But there wasn't any formal decision there. But it was an interesting conversation as far as oftentimes service providers grow where they see a financial demand, where they can best meet their bottom line, and versus community health boards might see a greater need in a different area, but maybe isn't as financially viable. So that was an interesting conversation. Also heard from, I believe it was City of Cloquet, they were going to be talking about the Tobacco 21 policy, and they're going to have some community listening sessions, and so I'm looking forward to hearing how those went and just what was brought up, and we can learn something there too.
Great.
Otherwise, just going through the transition or the upcoming search for the director's position was the topic at the personnel committee there too.
Excellent.
That'll be a big change.
It will be. Is that it from you?
I think so.
Thank you.
Am I forgetting something?
I had to step out in the middle of the
Oh, yeah.
meeting. Grace, anything that you would add from the Community Health Board? And just a reminder that Grace is participating in the strategic planning core team in talking about the future of the CHB.
No changes. Okay, Public Health and Human Service Advisory Committee, Carla and Jerry.
We did not have a meeting this month.
Healthcare Planning, Ginny.
Yes, we did meet. Kimber reported that she is in a dilemma about how to work with the vet's choice of local services. So right now it's a matter of how the state steps in to work with vets, and then what the local community will work with them on that. She's received a grant toward a new ambulance, which is good. And she's also, along with Paula from Grand Portage, concerned about the shortage of EMS trained people. They have done some educational training at the high school level, teenagers 16, 17, 18 years old, who would have an idea about what they could do and future help when they're a little bit older. So that's kind of a good place. They had about, they had a 9-hour training, and about a good number of teenagers attended that. Paula also reported that the Wellness Fair in Grand Portage will be June 22nd, so that's this week. And it's kind of a fun place to go to see the different venues that's set up there. They're also having a children's camp summer. And Kay said that she had a caregivers luncheon, appreciation luncheon for the folks who help out here in the county, and that was much appreciated by the group that put that on. August 25th is their ice cream social. And of course, Rita will be celebrating her 40th anniversary as service to our community and other areas on Monday, the 24th at 5:30, so we're
Was that their annual meeting?
They'll have that first.
On the 24th,
Mhm.
which everyone's invited to.
Yeah, at 5, yeah.
Okay.
And then they'll party.
Excellent.
Great honor for her, for us to celebrate with her. That's all.
All right, North Shore Collaborative, Dave.
Nothing to report this month.
Emergency preparedness?
We didn't meet.
No, we did, well, I think they met, but we didn't get notified.
Oh, did they?
I think you did.
Yeah, there was some scheduling.
But it was a busy day,
Oh.
so thank you.
Oh,
We
okay.
had-
Yeah, it was a transitional time where I was taking on facilitating the meeting and didn't have a complete list of people who had attended the committee, so only about half the folks got the meeting invite. Everyone got the minutes, but not everyone
Got the invite.
got the invite, so that was on me, that was my fault.
Do you want to give us an update of what you did with?
Sure.
You can say no, too, because you weren't prepared for that.
Allison, you wanna help me out with
Sure,
this?
yeah. So it was a small group meeting because of the snafu with about half of the membership not receiving notification. So again, our apologies for that error. There were representatives from the Forest Service, from the hospital. So there were a few other agencies besides our own in attendance. Grace and Valerie co-facilitate that meeting, and it was most notable perhaps in the fact that it was Valerie's last meeting with the Emergency Preparedness Committee. So it was a time to reflect on some of the great work that she's done as our emergency manager, and what the future holds for emergency preparedness, and really just recognizing the strength of this committee, that it's really wonderful how many other agency representatives we have coming together every 2 months to talk about emergency preparedness in this community.
Great.
We also did some debriefing on the conference. the
Yep.
Emergency Services Conference, and what went well and what folks would like to see different in the next years. We also planned for the July meeting, we're going to change locations to the hospital. We're going to do Zoom meetings there from now on, and the next meeting is going to be very heavily public health focused, and I'll give a presentation on points of dispensing. And then our regional epidemiologist will also be giving updates on regional disease.
Great. Thank you. Thanks for that unprepared update.
So we're going to meet every other month.
Yes, we're going to
July and then
meet every
September.
month when we do the next.
Be July then?
Yeah, July is the next meeting.
That's the, what, third Tuesday?
She can get to that to you after the meeting. For the good of the order. For the good of the order, I'll start out with, since we're doing a lot of recognition of mental health awareness, give a big shout out to Deputy Bauman, responded to a call, and he was thinking quickly and called in Deputy Spry and Deputy Eddy. There was a person visiting our area who was in duress and was talking about committing suicide, and Deputy Eddy went into the woods to try and find the person. Also responding was Deputy Hayes, Deputy Spry, Deputy Green, and Deputy Lundy, and they were able to flush the citizen out and get them the help that they needed. So I think that's a good shout out for good of the order and how we as a community help people out. And then if anyone else has, for the good of the order,
Sherry?
Jerry?
Oh, at the risk of touching a nerve here, the North Shore Healthcare Foundation is pretty excited that Valerie Marasco Eliason began yesterday as our full-time executive director. And it's the first time we've had a full-time executive director. And this following on the heels of our strategic planning process, we've got a lot of goals and ambitious things that we want to be doing, and have her expertise help us achieve those goals.
As always, we're sad to lose her. Thank you for acknowledging her and including her full correct legal name at this time. And we're very glad that she has you and that
Good.
she's still here in the community with us, so it's a good thing.
Yeah.
If there is no other, we have one?
Yeah.
Thank you.
Myself and Jeff and Agatha, and we had attended the census meeting on the 6th with very little people there. And I believe our next meeting's on July 9th, from what I've seen. And it would be nice to get some more people to come to that.
Excellent. Yeah, that helps us out with a lot of different things.
I would call out the Complete Counts Committee was authorized by the Cook County Board of Commissioners, and we had some scheduling issues with the first meeting. We had people that wanted to be there that weren't able to be there. We had some scheduling issues with the July meeting. We were originally going to be on July 11th, but I'm out of town at a conference that day, so I just moved it to a different day that week, and we'll get what we can. But we're including the schools, the local governing boards, and this time we are including the news media on the notifications, because I think that this is an important issue, and we need to get some awareness surrounding the work of the Complete Counts Committee, which is just to make sure that Cook County is well represented in next year's census count. That's primarily our goal. So we will have that meeting on the 9th, but we'll get some educational materials out into the community. You've got materials, you and Agatha brought materials back that you'll have at the Wellness Fair this weekend. So at the Wellness Fair, at Fisherman's Picnic, at subsequent events, we're going to be having items about the Complete Counts Committee and making sure that Cook County is well counted next year during the census.
Excellent. With nothing else, can I get a motion for adjournment?
So move.
I'll support.
Excellent. We are adjourned. Thank you. We do the holes at 10:30? Holly made some banana bread.
Okay.
Okay.
Oh, we got an hour.